Hi, my name is Dr. Karl Yousef, and I'm here to break down what to expect in the emergency department when you come in with high blood sugar. I'll walk you through certain things your doctor may be thinking about, and afterwards, I'll explain certain labs or imaging that you might receive. Depending on the complaint, we'll finish with some potential outcomes to expect if your doctor sends you home. Remember, in the emergency department, we don't just look for what is going on, we look for what isn't going on. What does this mean? It means that as emergency doctors, we always have a mental list of scary diagnoses that we have to make sure are not happening to you. So, even if we don't find the exact diagnosis within one ER visit, our goal is always to rule out big, bad, and scary things. As you go through your workup, remember that even if you don't see your doctor for some time, they are always following your results in the background. So, you're coming into the emergency room with high blood sugar. Having elevated blood sugar can be a stressful experience and can often have many associated symptoms such as headaches, dizziness, weakness, increased urination, increased thirst, and many other symptoms. Usually, your doctor will attempt to identify what could be causing your blood sugar to be so elevated. If you do not have a history of diabetes, a new diagnosis of diabetes will likely be considered by your doctor. If you do have diabetes, your blood sugar can be elevated due to poor control by your current medication or a host of other issues, including infections, various illnesses, and generally anything that puts your body under stress. Your elevated blood sugar may even be causing a condition called diabetic ketoacidosis, which occurs when your body is no longer able to remove sugar from the blood. You will very likely get blood work done to assess the severity of your elevated blood sugar and if any other illnesses are going on. Next, your doctor will likely give you medication to lower your blood sugar if it is significantly high, especially if your doctor believes that you may have difficulty lowering your blood sugar at home. After some time, your doctor will explain your results to you. If your doctor is recommending that you stay in the hospital, it could be for additional monitoring, or it could be that your doctor found something that needs extra attention. In either case, your doctor will explain to you the reason for keeping you in the hospital. Finally, if your symptoms improve and you're being sent home, I'm happy to hear that. Make sure to follow your doctor's recommendations, and if your symptoms are not improving or are getting worse at home, we always encourage you to come back to the emergency department to make sure nothing was missed on the first visit. If your doctor is allowing you to go home, it indicates that they have likely not found anything that requires hospitalization, and your blood sugar may have improved with medications during your stay. They will very likely instruct you to follow up with your primary doctor, and this is because they want someone to follow your blood sugar over time and adjust your medications appropriately. Now, sometimes your ER doctor may not have the chance to tell you this since the emergency room is a very fast-paced environment. So please listen up to this next section. We doctors see elevated blood sugar all of the time, and often this is a sign that there needs to be significant changes in your diet and exercise. Diabetes, the condition of elevated blood sugar, is not cured by medication. Medications alone are more of a band-aid and are not the cure to high blood sugar. This is why someone can keep getting more and more medications and not see a significant improvement. It can be tough, but increasing your physical activity is a must. Even if you start by walking half a mile or 1 mile each day, it can have a significant impact on your blood sugar. Please realize that your regular walking at work or elsewhere is usually not sufficient for physical activity. Building muscle mass by doing resistance training can also give your body more areas to store sugar. Next, you can try looking into a plant-based diet. Please feel free to search this on Google. A plant-based diet is composed mostly of fruits, vegetables, legumes, and nuts, A large component of this diet is removing processed foods. What are processed foods? They are essentially foods with more than one ingredient. These are foods such as soda, chips, microwave-ready quick meals, pizzas, and nearly all fast foods. This includes processed meats such as hams, salami, and other deli meats. Why? This is because many processed foods are often filled with simple sugars that, over time, overwhelm your body's ability to store glucose. As your body gets flooded by these simple sugars, it essentially gives up and loses its ability to store those sugars away, leaving all of the sugar in your blood. This can be dangerous because these sugars get into your brain, causing dementia, your blood vessels leading to poor blood flow to your arms and legs with an increased risk of infection, and even your eyes, leading to potential future blindness. They also affect your nerves, causing sensations of numbness and tingling in the hands and feet, and can cause conditions of constant vomiting and abdominal pain. Now, if you disagree with any of the above, that's okay. Just take the main point of increasing your physical activity and trying to eat a more clean diet than before. It will make a big difference in your fight against high blood sugar. I know that being in the emergency department can be an incredibly stressful experience, and I hope this is helpful for you. Again, this is Dr. Karl Yousef. Wherever you are, we care about you. We work hard to make sure that you're okay. While you wait, feel free to subscribe to this channel for more medical information from a board-certified emergency doctor. You can comment with video ideas that you want me to cover, and I'll take the time to reply to you. You can even watch some of the other videos on this channel for entertainment. Thank you for your time. I'm wishing you the best in your health.